A very good evening to all of you guys. A very good evening to all of you. A warm welcome to all of you guys. This is Dr. Azam here, Faculty of Anatomy. And welcome back to my Anatomy Rapid Revision session, day 2, the second day. So yesterday we have discussed about the upper limb topic, and we have discussed like head and neck topic, and along with that the embryology of the head and neck also we have discussed, guys. So now today actually I'm going to start with the another second session of the rapid revision here right now, and today we are going to discuss the most important topic, and that is neuroanatomy topic, guys. I'm going to start with the neuroanatomy topic. Like many of the students will be having a phobia with this one, and now I'll tell you very rapidly, okay, what are the topics to be remembered, and what are the points to be remembered for your MC exam scheduled on 31st August 2020, guys. Is it okay? So what I am telling you, please listen very carefully here right now, and we are going to do complete neuroanatomy. We're going to discuss right now very rapidly here right now, guys. Okay. So before moving ahead here right now, let me just tell you, like all the friends who have joined me today, okay, all the students who have joined me today for the very first time, yes, welcome to an academy platform right now, guys. A good news here, okay, we have actually clubbed with integrated with the prep ladder, and nowadays we are having like iconic subscription where you get both prep ladder as well as the Unacademy subscription, guys. Advantage of that, perfectly nice, that will be having the live classes in the Unacademy platform, whereas you'll be having all the recorded videos in the prep ladder available, guys, along with the question bank and all. And you can go to the website and check for all the details of that, with what discounts they are providing. Along with that, you can always add my code there for getting additional 10% discount. Okay, now Dr. Azam, DRAZAM. And apart from that, my dear friends, one more good news for all my students who are preparing for December exam. Yes, we are going to start with a complete batch course. In that, of course, anatomy will be taken. There are like top-notch faculties available who are going to take the other subjects also, guys. So we are starting that from 5th of September there for the students who are going to prepare for December exam. And again, the same thing I would like to repeat, whenever you're joining any course on an academy, you can always use my code for additional 10% discount, guys. Lovely. And without wasting any time further, let's get started with our discussion on neuroanatomy and what are the topics to be discussed or revised before going to the exam. So I request all of you to just give me a thumbs up, okay, if my audio and video is absolutely clear, and if you people are all ready for the discussion here right now, guys. Just let me know if you're all ready for the discussion here right now. Yes, my dear doctors. So observe here right now. This is the diagram of your brain and the spinal cord here right now. The very first thing which is important here for your MC exam is ventricles. Okay, the ventricles of the brain, guys. The ventricles inside the brain. That is important here right now. So I'll start slowly from simple topics here right now, the ventricles and all, and then slowly we are going to go towards the white matter, the gray matter, the commissures part, and then I'm going to even discuss the Brodmann areas as well as the tracts and everything. I'll touch each and every point, guys. So just observe here right now. So now, my dear doctors, welcome here. So now, my dear doctors, welcome here right now, guys. Yes. In this diagram, you're able to see all the ventricles here right now. And this big one which is visible here right now, this one will be the lateral ventricle, guys. That will be the lateral ventricle. You got to remember the name of the ventricle and you have to remember the location. Remember, the lateral ventricles are present in telencephalon. And I think this is like very high time right now. At this point of time, like don't ask me, sir, what is telencephalon and all. Nothing but the another name of your cerebral hemisphere, cerebrum, guys. Okay. And after that, yes, I hope you all know that there'll be two lateral ventricles. After that, my dear friends, this will be the third ventricle here right now, sir. That's your third ventricle. Okay. Now, my dear friends, if this is the third ventricle, what is the location? Remember, it will be located in diencephalon. Diencephalon. I want all my students to have like full concentration on two things there, the name of the ventricle and the location of the ventricle, guys. Apart from that, this ventricle here right now, this will be your fourth ventricle here right now, sir. That's the fourth ventricle there, guys. And remember, the fourth ventricle is present in the rhombencephalon. It's in the hindbrain, that is rhombencephalon, sir. So the lateral ventricles will be present in telencephalon, and the third ventricle will be there in the diencephalon, and the fourth ventricle will be there in the rhombencephalon, guys. Okay, rhombencephalon. Fine. Now, once you have learned the ventricles here right now, yes, that I think this is the best approach to learn here right now. The lateral ventricles are joining with the third ventricle. Yes, you can clearly see the foramen there, and which is very famously known as the foramen of Monro. That is known as foramen of Monro, guys. So lateral ventricles are connected to the third ventricle with the help of foramen of Monro. And the fourth ventricle, you can clearly see this duct here right now. It is connecting the third ventricle with the fourth ventricle, and that is known as the aqueduct of Sylvius. Aqueduct of Sylvius, guys. Okay, which is also known as cerebral aqueduct. Aqueduct of Sylvius, or which is also known as the cerebral aqueduct, guys. Lovely. Okay. So just to bring all you people in the mood of studying here right now, guys. So a small topic to begin with here right now. Is it okay? And we all know what is present inside the ventricles there. Inside those ventricles, you'll be having your cerebrospinal fluid, guys. That'll be the CSF there, guys. Lovely. Done. Now, once you are done with all these ventricles here right now and how they are connected, my dear friends, and now if you people are like completely ready here right now, welcome, 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 my dear friends. Let's start with the most important thing for your MCA exam, guys. That is your spinal cord topic, sir. So after a slight introduction here right now, starting 5 minutes, I think you are now in the mood of studying right now, everyone, guys. Now welcome to the most important thing, that is spinal cord, from where you can always expect a question, guys. And now the first thing that you have to remember for your MCA exam, sir, what is the extent of the spinal cord? Extent of the spinal cord is like extremely important, sir. Every now and then it can be asked in the exam, and I'm expecting this question in the next exam. Now, what is the extent of spinal cord? You and me right now. Yes, the spinal cord will be extending from C1 to L1. Okay, the first cervical vertebra to the first lumbar vertebra, guys. C1 to L1. And if you're interested, it will be up to the lower border of L1, guys. Now, apart from this, remember in neonates, that means in infants, what is the extent of the spinal cord? That has been already asked in the MCA exam. Remember, it is from C1 to L3. And if you are interested, it is up to the upper border of L3, guys. So that is one thing very much important that you have to definitely remember for your exam, guys. Okay. So in the spinal cord topic, extent is very much important. First thing. Okay, now I'll tell you all the higher topics, guys, all the extremely important things that you have to remember here right now. So once you are done with the extent of the spinal cord, and now, my dear friends, welcome to the ending part of the spinal cord, sir, the end of the spinal cord. There are so many MCQs here right now regarding the end of the spinal cord, guys. Yes, and you are going to help me here right now. We all know that the spinal cord is going to end in the cone-shaped structure. Listen very carefully, guys. That is a cone-shaped structure, which is known as conus medullaris. Spinal cord ends in a cone-shaped structure known as conus medullaris. And we all know that, yes, the spinal cord is ending at which level, sir? At the level of L1 only. Just now I told you. It is ending at the level of L1, lower border of L1. Now, as a simple medical student, as a first year MBBS student, guys, I'm getting a small doubt in my mind. So, if the spinal cord is ending at the level of L1, then what do you have after L1? L2, L3, remaining lumbar segments, and remaining sacral. What do you have there? Remember, there will be a fine thread-like structure. There'll be a fine thread-like structure that is going all the way up to your coccyx. Okay, so right from the tip of the conus medullaris, there'll be a fine thread-like structure going all the way up to coccyx, guys. Now, what is this fine thread-like structure? Remember, this one will be the filum terminale. This is filum terminale, guys. Okay, I hope all of you are writing there, guys. So whatever I'm telling you, even though if you have attended my regular class there, guys, please write down. Please write down, sir. The more you write down there, the more you will learn that. Okay. So even though you are having my notes, even though you have attended my classes, please write down. These are the important topics to be learned. Conus medullaris, and then there is a filum terminale. And now the most important question here is that, okay, what is filum terminale, sir? Filum terminale actually hota kya hai? What is this filum terminale? So I hope you all remember that our brain and the spinal cord are covered by 3 meninges. And out of that 3 meninges, guys, innermost meninge will be the pia mater. So imagine this red colored line to be your pia mater here right now, sir. That innermost meninge will be your pia mater. Now what is going to happen to this pia matter, guys? Yes, this pia matter will come there at the end. Is it just stopping there? No, it's not going to stop there, guys. This pia matter will actually continue down, continue down, continue down further. And yes, it will be going all the way up to coccyx. So that is like further extension of the pia matter, or I can say modification of the pia matter, and that itself is nothing but the phylum terminal. So what is phylum terminal? It's nothing but extension, or we can say the modification of pia matter. Oh. Understanding here right now? So phylum terminal, that thread-like structure, whatever we are telling, it's just an extension of what's a pia matter. It's a modification of pia matter. Now automatically I can see that question mark on your faces right now. So if this is pia matter there, then where is arachnoid matter and dura matter, sir? Arachnoid and dura matter kahan par hai? So come on, I'll show you here right now, sir. Where is arachnoid and the dura matter? The arachnoid and dura matter are going to descend down, and then they're going to come and meet here right now. The arachnoid and dura matter are going to descend down and going to, merge with this pia matter here right now. Okay. I'm just drawing like one line there. You just try to imagine that is your arachnoid, and outside you have got the dura matter. Whatever. I'm just drawing like one line. Now one simple question which has been asked in the exam, where is this arachnoid and dura matter meeting, at which level? Remember, they are meeting at the level of S2. The arachnoid and dura matter is meeting at the level of what, guys? S2. S2. And now listen very carefully. I want like 200% concentration here, my dear friends. If this is your pia matter here, the red colored line, and this is the arachnoid matter here, can you please tell me what is the space between arachnoid and the pia matter, guys? That is nothing but subarachnoid space. And what do you have in the subarachnoid space? I hope you all know in the subarachnoid space you'll be having the CSF. In the subarachnoid space you'll be having what, guys? The cerebrospinal fluid will be there in the CSF there, guys. Is it okay? So in one of the exam, the question was very simple. Where is the arachnoid and dura matter meeting? Where is arachnoid and dura matter meeting? They are meeting at the level of S2. In another exam, they have asked the question in a very twisted manner, the subarachnoid space. Yes, the subarachnoid space ends at. Oh my God. Ends at. Again, the answer will be the same, guys. Ends at the level of what? S2. Lovely. So I repeat again here right now. In one of the exam, the question is very simple. Arachnoid and dura matter are meeting at which level? At the level of S2. And at the same time, they are even asking the another question in a twisted manner. Where will subarachnoid space end? Yes, again it will be ending at S2 only, guys. Okay. Now you might be thinking, okay, why is Dr. Azam going into so much details in the end of the spinal cord here right now? I'll tell you the importance of this one. My dear doctors, did you study anesthesia? I think just hardly like 2 or 3 days left for the exam. I think you definitely have learned anesthesia here right now. Yes, in that you might have learned about. Yes, look here. Spinal cord is ending at the level of L1, and arachnoid and dura matter is joining at the level of S2. And in the middle here, yes, I get a clear cut chance here right now to do the lumbar puncture, guys. Are you understanding here right now? So I can do the lumbar puncture over there, guys. So that is the place where we can do lumbar puncture. Why? Because already the spinal cord is ended at the level of L1 only, and the subarachnoid space is getting at the level ending at the level of S2, guys. So that's the beauty of learning this entire ending of the spinal cord in a crystal clear manner. I think it's like very clear to each and every one of you guys. Lovely. Understanding here right now? So I'll just repeat this again very quickly here right now, my dear friends. The spinal cord ends in a cone-shaped structure, conus medullaris. There is a thread-like structure, phylum terminal, nothing but the modification of the pia matter. And arachnoid and dura matter is meeting at the level of S2. Remember, the subarachnoid space also ends at the level of S2 only. That is the reason why we are getting a chance to do the lumbar puncture there, guys. Lovely, lovely. That's a clear-cut, a very crystal clear-cut concept, guys. So this is the place from where most of the questions are being asked in the spinal cord, guys. Lovely, done. So remember the extent of the spinal cord and remember the ending part of the spinal cord, guys. Is it okay? Fine here right now? Yes. Rurico 16. Rurico 16, I am reading all the chats there. And I'm really happy that you will are answering all the questions there. Okay? So मैं बिल्कुल read कर रहा हूँ. Don't worry about that one. तो चलिए, this is what you have to learn. And after that, my dear friends, the transverse section of spinal cord, everyone is like perfect. So we don't have to worry about that one. Cauda equina, every student knows, the bundle of nerves there. At the ending of the spinal cord, the bundle of nerves is known as cauda equina. And learn with the meaning. Cauda means is actually the name of the horse, guys. Okay, na? Genus name of the horse. Cauda equina, bundle of nerves. Fine. चलिए, अब हम बढ़ते हैं आगे. After revising this topic and important points to revise here right now, welcome to the next thing that you have to learn in the neuroanatomy part, guys. Yes. Can anyone tell me or answer this question to me here right now? Which of the following is a part of corpus callosum? Putamen, splenium, tegmentum, and the tectum. Come on, guys. Putamen, splenium, tegmentum, and the tectum. Yes. Can anyone tell me what is the answer for this one here right now? Yes, Kadam. Thank you. Thank you. Thank you, Mohammed Salman. Okay, that's really nice. I'm getting some, correct answers there. Priyanka, Shubhalakshmi. Yes. Oh, Mohammed Pasha. Now everyone started there. Yes, guys. The correct answer for this one is actually splenium. So I think now you're understanding here. I'm slowly moving towards the next topic. The next topic is about the commissures. Okay. Guys, I hope you all remember. Guys, I hope all of you remember that. Yes, listen here. The correct answer there is splenium there. I hope all of you remember that the white matter fibers which are going to connect the right half of the brain with the left half and the left half of the brain with the right half, right and left half. Okay, right and left half of the brain are connected by commissural fibers. And let me show you right now the commissural fibers in sagittal section. Everyone please look at this diagram here right now, sir. Okay. So welcome to my anatomy classes, guys. I'll make you really perfect in all the images of the neuroanatomy, guys. Yes, this diagram of the brain is exactly in the sagittal section. So I'm cutting my brain exactly in the middle here right now. And after cutting my, brain exactly in the middle here right now, guys. Yes, what I'm going to do here right now, I'm going to remove the one half of the brain and throw it off. The other half I'm seeing from a side here right now. So when I'm looking at my brain from the side here right now, it's absolutely like this. In this, I'm able to see the largest commissure here right now, guys. This will be the largest commissure here. And yes, that is your corpus callosum, guys. So this is the largest commissure known as the corpus callosum. Corpus callosum, guys. So fibers connecting the right half with the left half as nothing but, commissural fibers. And out of all your commissures, the largest commissure will be corpus callosum. Already this MCQ has been asked in the exam, largest commissure. Not only that, they have even asked in the exam what are the parts of the corpus callosum. Remember, there are like 4 parts here right now. Number 1, rostrum, and this bent in the front here will be the genu, and this will be the body of the corpus callosum, and finally this will be the splenium part of that one, sir. Okay. So there are totally like 4 parts here right now, sir. Corpus callosum. I'm just writing the full form here. R stands for rostrum in the front. And that bent, the bent is nothing but genu, and then you have got the body there, and that part behind will be your splenium part. Lovely. I'm explaining you in this manner. Why? Because I want my students to be ready even for the image based questions also. So the moment you look at this image, don't get panicked from today onwards, guys. Welcome here. So that's your largest commissure. So let me write down the heading there, guys. We are actually learning about the commissures. And that is the largest commissure, guys. That is your having 4 parts. Now, sir, are there any other commissure? Of course, we also have got like other commissures also. Yes, this one here right now, below the rostrum, this commissure will be your anterior commissure. Below the rostrum, that will be anterior commissure. And yeah, below the splenium here right now, what you do is, if this image is given in the exam, okay, now, if this is, image is given in the exam, below the splenium, first of all, you try to find out the gland. And that gland will be the pineal gland. That's your pineal gland there, guys. And just below the pineal gland, you are able to see like one more commissure here. And this commissure will be the posterior commissure. Below the pineal gland, there will be like posterior commissure. And above the pineal gland, so pineal gland ke upar, this one here right now will be the habenular commissure. That is habenular commissure. Fine here. So kul milakar, in total you'll be having like 5 commissural fibers, guys. The largest one will be the corpus callosum. Below the rostrum there will be anterior commissure, and then below the pineal gland posterior commissure. Above the pineal gland there will be habenular commissure, guys. Is it okay? And here below the body of the corpus callosum you'll be having like one more commissure, important one, that is hippocampal commissure, guys. But that is not given here right now in this diagram. We'll be able to see that in the different view there. Okay, so that is your hippocampal commissure, guys. So I'm just writing the 5th one over here. There'll be one more hippocampal commissure, and that will be present like below the corpus callosum. So that is about the topic of all the commissural fibers. I repeat again: number 1, corpus callosum; number 2, anterior commissure; number 3, the posterior commissure; Number 4, the habenular commissure. And number 5, the hippocampal commissure, guys. All these are the 5 commissural fiber. So we are done with the topic of commissural fiber. At the same time, we are even done with the image also, so that my students are now, yes, ready to learn about, even ready to answer about the image based questions right now, guys. Okay, that completes the topic of commissural fibers. And coming back to this question again, which of the following is a part of corpus callosum? Which of the following is a part of corpus callosum? That is splenium, guys. Putamen will be actually a part of your basal ganglia. Don't worry, I'm going to teach you about the basal ganglia. And tectum and tegmentum, these two you'll be finding in the midbrain parts. ये ना midbrain में होते हैं. They are not a part of your corpus callosum, guys. They are found in the midbrain. Lovely. I think it is crystal clear here right now, sir. Okay. Thank you, Anjali, for the appreciation there. Yes, lovely, guys. I think it is crystal clear to all of you guys. Let us move to the next concept here right now. Apart from commissural fibers, now let us move to the next concept, the tracts. Oh my God. Now actually tracts are those white matter fibers which are going to connect your brain down to the spinal cord and spinal cord up to the brain. They'll be like in vertical direction. Just now I taught you commissural fibers. Commissural fibers are going to connect the right half of the brain with the left half of the brain with the right half, and right and left half. But now the tracts are the one which comes under the category of projection fibers, up and down. They are going to connect your brain and the spinal cord. And now I'll tell you exactly what are the things to be remembered for the tracts right now, guys. So please concentrate here. Okay, now for 5 minutes. Yes, and start drawing the diagram along with me. Draw the diagram along with me, guys. Even though if you have attended my regular class, I request all of you to please draw the diagram. In one diagram, I'll give you everything here right now, guys. So imagine this one to be the transverse section of the spinal cord here right now, sir. If this is the transverse section of the spinal cord, there'll be a posterior median sulcus, and then there'll be an anterior median fissure. And I hope all of you know that we have been learning this from our school days. This will be your H shape or the butterfly shape gray matter. And exactly in the center, you'll be having central canal. Fine. And the gray matter will be having those horns, dorsal horn and the ventral horn. And the white matter will be known as what? Columns. Everyone knows that the white matter is known as columns, guys. Lovely. In one diagram, we are going to complete like everything. Observe here right now. Now, what I will do here is right now, I hope all of you know that the tracts which are moving down will be your descending tracts. I'm going to write down all your descending tracts to be remembered for MCA exam on this side. And all the ascending tracts which you have to know for your MCA exam, I'll be writing on the other side here right now, sir. So please write down there as ascending tracts. You have to refer this on the day of the exam and go to the exam, guys. So again, 31st August 2020, refer this one diagram and go to the exam. Now, as a doctor, as a medical student, each and every student should know that the dorsal column, white matter, it will have only and only ascending tracts. Yes, in the lateral column, you'll be having both ascending as well as descending tracts. And then, yes, the anterior column will have both ascending as well as descending tracts. This you should always know by default. Is it okay? So dorsal column, you'll be having only and only ascending tracts. The lateral column will have both ascending and descending, and the anterior column will have both ascending as well as descending tracts, sir. Okay. And now, my dear friends, first of all, welcome to the descending tracts here right now, sir. तो सबसे पहले हम लोग ना descending tracts से deal करते हैं. There is one descending tract here in the lateral column, and there will be one more descending tract here in the anterior column. ठीक है ना? There is one descending tract in the lateral and the anterior column, guys. Now we need to give the name for this one here right now. What is the name of this one here right now? So remember, my dear friends, here right now, descending tract means what? So it's going to begin from your brain, and in the brain, the outermost part of the brain, that is cerebral cortex. It's going to begin from the cortex, guys. So because it's going to begin from the cortex, it's cortico, and then it is going to come down to the spinal cord. Cortico-spinal tract. Lovely. So it is cortico-spinal tract. And I think my students are intelligent enough to give the name here right now. This is in the lateral column. That is the reason why that is your lateral cortico-spinal tract. Okay. And another one here right now, this will be known as your anterior cord. So there will be a lateral corticospinal tract and anterior corticospinal tract. I think you people know this very well with the name of pyramidal tract, sir. Another name of the corticospinal tract, it is also known as the pyramidal tract, guys. Okay, very famously, it is known as the pyramidal tract. So pyramidal tract is nothing but your corticospinal tract, and you have got like two of them. One is the lateral, another one is the anterior corticospinal tract. So that's all. That's the only one descending tract that you have to learn for your MCA exam. So that's the only and only one descending tract that you have to learn for the MCA exam. Acha. In this pyramidal tract, what is the point that I have to learn here right now? The point that you have to learn here right now for your exam, question number 1, yes. In this pyramidal tract, the fibers will be crossing, and that crossing is known as what, guys? Decussation. That is pyramidal decussation. In the pyramidal tract fibers will be crossing, and that crossing of the fibers is known as decussation, pyramidal decussation. And you have to just remember the location of that one. Remember, it's gonna take place in the lower part of medulla oblongata. So you can just remember the lower medulla. Always in the MC exam, it will be asking the same question, and I'm even expecting this question in the August exam, guys. August exam, I am expecting this question here right now. So pyramidal decussation kahan par hota hai? They'll be always asking you only the location of that one. Remember, pyramidal decussation will be taking place in the lower part of medulla oblongata. Lower medulla oblongata. Done. Then after that, my dear friends, one more point that you have to remember is what is the what is the function of this pyramidal tract? Obviously, descending tract will be having motor function only, and they are going to control what? The skilled voluntary movements. The pyramidal tract is going to control what, sir? The skilled voluntary movements. Skilled voluntary movements will be controlled by the descending tract. Means what? It is going to definitely carry what, sir? Yes, the motor functions. So skilled voluntary movements will be controlled by the pyramidal tract. Lovely. These are the points that you have to remember for your exam. That's all. Okay now. And for some of the students here right now, guys, I want to tell you something here right now. Okay, don't think, sir, this will be how the neuroanatomy in our regular classes. Please remember that very clearly, that this is actually the rapid revision session that we are doing. So revision, actually you have to always now view the subject. For reviewing the subject, always you have to view the subject. So please don't judge me on this one. Okay, this is how it is going to be. Now, when you come down to my, the regular classes, neuroanatomy will be taught almost for like 8 to 10 hours for MCA exams. For the MCA students, I'll be teaching like neuroanatomy for almost like 8 to 10 hours, guys. So we'll be having like entire detailed discussion starting from the scratch. So इसीलिए ना, so please don't have a wrong sense in your mind, this is how it is going to be. It'll be like fantastic when we do that. So now what you do is, just for the sake of for the sake of exams, yes, just target oriented. You just take it like one topic. Okay, commissures, done. Spinal cord, done. Similarly, tracts are done. So in this manner, I want you to, yes, learn here right now, guys. Now apart from that, what are the ascending tracts you have to learn here right now, sir? Come on, welcome. Now in the ascending tracts, my dear friends, remember, there'll be one ascending tract here in the lateral column, and there'll be like one more ascending tract here in the anterior column. And that is a very famous one. It's going to ascend up from the spinal cord, and it is going to all the way go to the, yes, thalamus. So that is why, what is the name of that? Spinothalamic tract, spinothalamic tract. And now, my dear friends, this one in the lateral column, lateral spinothalamic tract. So it is lateral spinothalamic tract. And this one is here in the anterior column, and that is known as the anterior spinothalamic tract. So from the name itself, you can understand it is going from the spinal cord to the thalamus above. So it is ascending tract, spinothalamic tract. Okay, spinothalamic tract, lateral and anterior. Okay. And apart from that, in the dorsal column, you'll be having two of them. One will be on the medial side, that is your fasciculus gracilis, and one will be on the lateral side here right now, guys, and that will be fasciculus cuneatus. I'll write on the name here. This one here will be your fasciculus gracilis. This is fasciculus gracilis tract here right now, guys, and this one here will be your fasciculus cuneatus. And what is the thing that you have to remember here for your MCI exam? Yes, I'll tell you. Yes, you got to remember for the MCI exam the functions of this tract, guys. Functions are at most important. And now, my dear doctors, ascending tracts. Yes, the ascending tracts here right now will be carrying which functions, guys? Sensory functions. And sensory functions will include all that, the touch, temperature, pressure, and all that will be carried by your ascending tracts only. And out of that, remember, the lateral spinothalamic tract is the one which is going to carry, yes, what is going to carry the lateral spinothalamic tract? That pain and temperature, guys. This lateral spinothalamic tract is going to carry also pain and temperature. Is it okay? So pain and temperature will be the will be carried by the lateral spinothalamic tract. Okay, and remember the anterior spinothalamic tract is the one which is going to carry touch, and which touch it is going to carry, guys? It is going to carry the crude touch, and along with the crude touch it is also going to carry the pressure, guys. So crude touch and pressure will be carried by the anterior spinothalamic tract, sir. And now I'll tell you like how to remember this one. I have seen like during our classes many students will be like having a confusion in this one, how to remember. Yes, I'll tell you in a little bit Hindi here right now. Try to understand here. Don't read this LAT as lateral. इसको ना read that as लात. और आप जब किसी को लात मारते हो ना उसको बड़ा दर्द होता है, बड़ा पेन होता है. और पेन कहाँ से पास होता है सर? लात स्पाइनोथैलेमिक ट्रैक्ट. और ना नॉट ओनली नहीं लेकिन नॉट ओनली लाइक दर्द होता है. जैसे आप जब किसी को लात मारते हो तो उसको दर्द भी होता है और उसको ना बड़ा गुस्सा आता है, उसका टेम्परेचर बढ़ जाता है. सो रिमेंबर सम दैट आप जब किसी को लात मारते हो तो उसको पेन होता है और उसको ना बड़ा गुस्सा आता है, टेम्परेचर बढ़ जाता है. सो पेन एंड टेम्परेचर आर गोइंग थ्रू द लात स्पाइनोथैलेमिक ट्रैक्ट एंड यू विल नेवर फॉरगेट दैट इन योर लाइफ टाइम, गाइस. Fine. And how to remember this one here right now? Don't read that as anterior. इसको ना anterior करके मत पढ़िए. ANT you read like and. Okay. हाँ जी. Don't read like anterior. Read like ant, guys. Or ant CNT. तो मान लो कि if the ant is crawling here right now, guys. If the ant is crawling, will you like the touch of the ant? Okay. No, sir. Okay, someone is telling there is auntie. नहीं, auntie वाला बिल्कुल नहीं होता है. You're all like foreign medical graduates. You already know. You also have got experience. Auntie वाला touch ना crude touch नहीं होता है, fine touch होता है सर. Okay ना? So it's not like crude touch. It is actually fine touch. So remember, it is not like crude touch. It is fine touch. Auntie वाला. So that mnemonic is not good one. Don't use auntie there. Use ant. Ant का मतलब क्या है? Ant चींटी. चींटी चीमा. Is it okay? So when ant is crawling here right now, my dear friends, yes, that touch I don't like. It is like crude touch. And then I'm going to apply pressure on that one. So therefore, make some mnemonic and remember, anterior spinothalamic tract is going to carry the crude touch and pressure, guys. Anterior spinothalamic tract is going to carry the crude touch and the pressure. Is it okay? Oh. So pain and temperature is carried by lateral spinothalamic tract, lat spinothalamic tract. Crude touch and the pressure will be carried by the anterior spinothalamic tract, sir. Done. Is it okay? Now, after completing this one, I can see there most of the students are like now, and now they're like very much enthusiastic right now. सर फिर वो आंटी वाला टच कहाँ से पास होता है सर? लेकिन फाइन टच कहाँ से जाता है? तो डोंट वरी, आई विल टेल यू राइट नाउ कि फाइन टच इज गोना पासिंग फ्रॉम वेयर. ठीक है ना? आंटी वाला टच कहाँ से पास होता है सर? यस, दैट इज गोइंग थ्रू योर बोथ fasciculus cuneatus and the fasciculus gracilis, guys. These two tracts, their function, yes, they are going to carry the fine touch, and not only fine touch, sir, even they are the one which are going to carry what? Even vibration sensations, sir. So fine touch will be carried by fasciculus, gracilis and cuneatus, and even the vibration sensations are also carried by the fasciculus, gracilis and cuneatus. I think मुझे आगे कुछ बोलने का जरूरत नहीं है, आप मेरी भावनाओं को समझ सकते हो, है ना? So fine touch and the vibration sensation. Apart from that, yes, guys, remember even stereognosis. I hope you all know what is the meaning of stereognosis, guys. Stereognosis is nothing but, yes, the ability to identify without seeing, guys, blind recognition. Without seeing, we have to identify just by touch, and that is nothing but stereognosis. And even it is the one which is going to carry the proprioception, guys. Even it is also going to carry what's a proprioception. And proprioception, the joint position of the joints, like your upper limb and the lower limb present pair there is. Okay. So fine touch, vibration, stereognosis and proprioception will be carried by fasciculus, gracilis and cuneatus, guys. So on one side we are having descending tracts, on the other side we are having ascending tracts. Study this and go to the exam, guys. The questions will come from here right now. Is it okay? So that is what you have to learn about the tracts right now. That's all. Done. That is what you have to learn from the tracts here right now, sir. Done. Now once you are completed with this one here right now, yes. Someone is continuously writing there, sir, to discuss about the Brown-Sequard syndrome. See, whatever time that has been given to us, guys, in that time, I'm not going to touch like other subjects right now. So Brown-Sequard syndrome you can study in your pathology or medicine there. Right now, let me just keep it to anatomy here right now. So because we can cover as many topics as possible in the anatomy part here right now. So I don't want to go into that one, guys. Okay. Chalo sir. Let's go ahead here right now. After completing about the commissural fibers there and after completing about the tracts there guys, let's go ahead with the next topic. Yes, that is the broadband areas. Now after completing the white matter part, I'm slowly moving towards the gray matter part, the broadband areas. So let me quickly tell you the name of the area and the number of the area and the location of all these broadband areas right now guys. So please draw the diagram of the cerebral hemisphere there. This is our cerebral hemisphere here right now. Now in this cerebral hemisphere, this is your temporal lobe here right now. In the temporal lobe, you'll be having like two sulci. There'll be two depressions. If there are two sulci here right now, my dear friends, there'll be three gyri. If there are two sulci, then there'll be like, three gyri. And in the uppermost one, that is your superior gyrus here right now. In the superior gyrus, you'll be having area number 41 and area number 42 here. And that area will be your primary auditory area. तो आपको क्या करना होगा सर? You got to learn like three things here right now. I want you all to be like very quick here right now. You have to learn like three things here right now. What is the name of the area? Primary auditory area. What is the number of the area? 41, 42, and it is located where? In the temporal lobe, superior temporal gyrus. Just behind that, you'll be having area number 22, and remember that will be your auditory association area. That is auditory association area, sir. Okay. So auditory area will be located where only guys? In the temporal lobe. Primary auditory area 41, 42 and the auditory association area number 22 guys. Done. And now welcome to the frontal lobe here right now. Again the same story here right now in the frontal lobe. You'll be having like two sulci here right now. If there are two sulci, there'll be like three gyri. And welcome to the lowermost one, sir. That is your inferior frontal. Inferior frontal gyrus, you'll be having area number 44 and 45, and that is the place where you'll be having your Broca speech area. Oh, ho, ho, ho. That is your Broca speech area, sir, and that is the area because of which I'm able to speak right now. So that's the motor area. So Broca speech area is nothing but your area number, yes, 44 and 45, located in the inferior frontal gyrus. Inferior frontal gyrus. And yes, Deepu is asking about the Wernicke and Surendra is asking about the Wernicke. Look here. 22 and then here you'll be having the area number 39 and then 40 here right now guys. Area number 22, area number 39 and area number 40. I'll just highlight here like this guys. I repeat again, area number 22, area number 39 and area number 40. These three together, yes, that's nothing but your Wernicke speech area, sir. That will be the Wernicke speech area here right now. And what is the difference between two speech areas, sir? Why do we have like two speech areas here right now? One is the motor speech area and this Wernicke speech area will be your sensory speech area. And I think you have learned in the ENT part about the aphasias, the motor aphasia and the sensory aphasia and all those things. I hope you can correlate with the other subjects here right now guys. Very good. Okay. So Broca speech area 44, 45 in the frontal lobe there and it is motor, whereas Wernicke speech area will be 22, 39 and 40. Yes, remember that will be the sensory speech. Lovely. And after that, every medical student knows about this sulcus here right now. So there'll be a very prominent, clear-cut, well-demarcated central sulcus. And right in front of the central sulcus, you'll be having area number 4. And in front of that, you'll be having the area number 6 there, guys. And these two will be your motor areas. One will be primary and another one will be the premotor area. But abhi ke liye you can just remember, area number 4, area number 6 will be the motor area. And behind the central sulcus, there'll be area number 3, 1 and 2. And remember this one will be the primary somatosensory area, sir. That is the primary somatosensory area. And that's behind the central sulcus. That is post-central. So in front of that, pre-central, you'll be having 6th and 4th one, motor area. And behind the central sulcus, you'll be having the primary somatosensory area. So if it is primary, what about the association? Yes, here you'll be having the area number 5 and the area number 7 here right now. And these two will be the somatosensory association areas. These two will be the somatosensory association area. Area number 5 and area number 7 will be somatosensory association area. And then finally the area number 17 here and the area number 18 here and 19 here, my dear friends. All these three will be your visual area. Visual area in the occipital lobe behind. So 17th will be the 17th will be the primary motor area, whereas the 18th and 19th will be the, yes, that is nothing but the, sorry, 17th will be primary visual area, 17th will be primary visual area, 18th and 19th will be the visual association area, guys. Visual association area, yes. Parvati Vyas, What will be the area number 7? Fifth and seventh area, fifth and seventh, both of them will be somatosensory association area. Somatosensory association area, guys. That's all. If you remember these many broadband areas, that will be more than enough for you for your MCA exam here, guys. Okay, now for your MCA exam, remember all these three broadband area, all these broadband areas, more than enough. Okay, so you have to remember the name of the area, the number of the area, and where are they located, guys. The name, number, and where are they located. Done, guys. Lovely. And now now my dear friends, after completing this one here right now, yes, after completing all these broadband areas, the next topic that we are going to discuss here, the most important topic is for your MCA exam, that is a blood supply. And for learning about the blood supply, you have to learn about what, guys? The circle of Willis. Okay. Circle of Willis here right now, guys. So welcome to the blood supply to your brain here right now, sir. So what you do, whatever you know, topics that I am telling you, guys, you have to remember those topics only for your MCA exam. So remember about the spinal cord, the ventricles of the brain, the commissural fibers, and the tracts. I told you what are the points to be remembered here right now. And apart from that, yes, I told you about one more topic, that is about the broadband areas. And now welcome to the blood supply, very much important here right now. Circle of Willis. Now, how to remember the circle of Willis? I'll tell you one thing, guys, here. How to remember the circle of Willis? Actually, when it comes to the blood supply to the brain, you're having like two things here right now. Okay, now. One will be the anterior system, internal carotid artery here right now. Another one is the posterior system here right now, guys. That is your vertebral artery. So anteriorly, you'll be having the internal carotid artery there, and posteriorly, you'll be having the vertebral artery there, guys. Is it okay? Fine here right now. Now, let me draw the diagram here right now about the circle of Willis, and you also start drawing along with me, guys. Posteriorly, there will be two vertebral arteries, and those two vertebral arteries are going to fuse together to form your basilar artery, and basilar artery will be finally dividing into posterior cerebral artery. So these two will be your vertebral arteries here right now. They'll combine together to form your basilar artery here right now, and this basilar artery will be finally dividing into the posterior cerebral artery, guys. Posterior cerebral artery. Fine. Cerebral artery. That is about your posterior system. So vertebral arteries are going to ascend up. If you remember my yesterday's class, you can even go back and see the video on YouTube, guys. Is still available there. Yes. My dear friends, remember the vertebral artery will be the one, yes, which is going to pass from where? It's going to pass from the foramen magnum. Yesterday only I taught you in the head and neck topic there. So the two vertebral arteries are going to ascend up, and they'll be combining to form the basilar artery, and basilar artery will be finally dividing into the posterior cerebral artery. Posterior system. Anteriorly, what do you have, guys? Internal carotid artery on one side, and there'll be internal carotid artery on the other side here right now. And this is going to give rise to a branch, that is anterior cerebral artery, and there will be anterior cerebral artery. Lovely. And I told you that there'll be like, you know, three different types of cerebral arteries: anterior cerebral, middle cerebral, and the posterior cerebral. And remember, my dear friends, even the middle cerebral will be, yes, the internal carotid branch only. It's a continuation of that one, guys. So internal carotid artery, I repeat again, that will give you anterior cerebral and the middle cerebral, whereas the basilar artery will give you the posterior cerebral artery. And after that, what you do, guys, after completing the posterior system and the anterior system, join them together right now. So the anterior cerebral arteries is joined together with the help of anterior communicating arteries, ACOM. Okay, both of them are joined by anterior communicating artery. And now look here very carefully. Internal carotid artery, already I taught you two branches, ACA, MCA. Now welcome to the next one, that will be your PCOM, sir. The posterior communicating artery. It will go and join here right now. There'll be one more artery given here, that is your posterior communicating artery here right now. Wow, awesome. Crystal clear concept. And you can clearly see there's a formation of circle there, guys, in the middle, and that is nothing but your circle of Willis. So in this manner, what is going to happen? The circle of Willis will be formed here right now. Kya baat hai? Are you understanding, my dear friends, here right now? That's how circle of Willis will be formed here right now. So like, you know, neuroanatomy, most of the students will not be learning during their MBBS days, guys. That is the reason I'm telling you a little bit slowly here right now. And all are like selective topics, and we are expecting questions from these topics, guys. So get set ready for your exam. Is it okay? Fine here right now. Circle of Willis. अब यार सवाल क्या आता है? What is the question here right now, sir? What type of questions will they ask you? One type of questions in the exam will be arteries forming circle of Willis. You need to learn arteries forming the circle of Willis. And you don't even have to mug up this one, so look at my diagram here right now. Posterior cerebral artery, and then the posterior communicating artery, the internal carotid artery, then the anterior cerebral artery, and anterior communicating artery. Exactly the same on the other side, the anterior cerebral, internal carotid, the posterior communicating, and the posterior cerebral artery. Let us write down here right now. The posterior cerebral artery, the posterior communicating artery, internal carotid artery here right now, and then the anterior cerebral artery, and then, my dear friends, the anterior communicating artery. These are the arteries which are going to form the circle of Willis, guys. These are the arteries which are going to form the circle of Willis. Lovely. We can expect one question from this in the next exam, sir. 31st August, I'm expecting one question from circle of Willis. Yes, you have to learn this one. Okay. And now one more question here right now, my dear friends. Yes, out of the three cerebral arteries, anterior cerebral, middle cerebral, and posterior cerebral, which is not forming circle of Willis, remember, middle cerebral artery is the one which is not forming circle of Willis, sir. That is the one which is not forming the circle of Willis. So middle cerebral artery is the one which is not forming circle of Willis, guys. That is very, very clear here right now. So let us see this one in our diagram here right now. Suppose if they give you the image based question, you have to be ready, and there are more chances of image based question in this one, circle of Willis. Come on. You can clearly see this artery ascending up here right now, vertebral artery, and this one is your vertebral artery. Both of them will be combining to form your basilar artery, and the basilar artery will be finally dividing into the posterior cerebral here and the posterior cerebral here. Leave it here. This one is your internal carotid here right now, and you can clearly see this is anterior cerebral artery here, and this one is your anterior cerebral artery here right now, and both of them are connected by ACOM, anterior communicating artery. This will be the middle cerebral artery which is going here right now, so that is your middle cerebral artery, and this will be the posterior communicating. So all of them will be joining together here right now to form the circle of Willis. Extremely important topic. Yes, you can expect one question from here in the next exam, guys. Done. After completing this one, now my dear friends, quickly let us move towards the embryology part of the nervous system, sir. Okay, so let us quickly discuss this one here right now. Embryology part of the nervous system. That is your CNS embryology, sir. Now whatever image that you're able to see here right now on the screen, whatever image you're able to see on the screen, that image is actually of the neural tube here right now, sir. This is your neural tube here right now. And neural tube is the one which is going to form what? Your central nervous system. What is included under central nervous system? Number one, it will include your brain, and number two, it will include your spinal cord, guys. So remember, that's the neural tube there, and the neural tube there, my dear friends, it's going to form your central nervous system. Upper part is going to become your brain there, and the lower part is going to become your, yes, spinal cord. I will take up all your doubts at the end, guys. So let me just, finish off this one here right now. So upper part will be, going to form your brain, and the lower part is going to form the spinal cord there. And the most important thing in the neural tube topic here right now, yes, can you see one opening here right now, guys? There is a neuropore here right now. And can you see one more opening here right now? The neuropore there. Now tell me here, do you have any opening here in the brain? No. Do you have any opening here in the spinal cord? No. In the very beginning, I taught you spinal cord will be closed there. So ये close होना चाहिए. तो पहले तो यार इसका नाम सीखो. Learn the name of this one here right now. It is known as anterior, or else it is also known as cranial, or else you can also use the word as rostral. That was used in 2019 MC exam, sir. Anterior or the cranial or the rostral neuropore. Fine. And then what about this pore here right now, this opening here right now? That will be your posterior, or you can use the word as caudal neuropore. Now the first point here right now, should it remain open? No, it has to be closed, and you have to remember when it is getting closed. Remember, anterior neuropore will be closes on day 25th day. Okay, after 2 to 3 days, remember the posterior neuropore closes on 28th day, guys. So posterior neuropore will close on which day, sir? On the 28th day. But in the exam, if they are giving the option which is like closer, in some of the questions now they are not giving like 28th day, they are giving like 27th day. So you can remember that one also, guys. Anterior neuropore closes on 25th day, and the posterior neuropore closes on the 28th day. Okay. You and me, we are like very lucky people. Your neural tube and my neural tube has been closed, and our brain and spinal cord are like very perfect. Thank God, thank God. In some unfortunate babies, what is going to happen? This neuropore, like, fails to close. If the anterior neuropore fails to close, then what is going to happen? It will lead to a condition known as anencephaly. And remember, if the posterior neuropore fails to close, agar posterior wala close nahi hoga, then it will lead to a condition known as your spina bifida. So anterior neuropore, the cranial neuropore, if it is not closing, that is anencephaly, and the posterior neuropore doesn't close, the spina bifida. So what I have done here right now, guys, in one lecture itself, I have tried to complete like everything possible here right now in one slide. Neural tube, the derivative of the neural tube, everything is done. The cranial neuropore and the caudal neuropore, done, done, and done. Now please look at this diagram. In this diagram, it is actually your first condition, that is your anencephaly. There is a failure of closure of the cranial neuropore, and in this condition you are able to see here right now there is a failure of closure of the caudal neuropore leading to spina bifida. So tomorrow if they give these questions in the exam, so you have to be ready for that one. And now my dear friends, welcome to the next and the most important thing. Yes, neural crest cells derivatives, one of the most important topic and one of the most controversial topic. Different answers are given in different books. Just remember whatever I'm telling you here right now, sir. So number one, neural crest cells derivatives, remember ganglions, guys. Yes, all the ganglions in your body. The moment you listen the word as ganglion, mark the answer. Yes, it is a neural crest cells derivatives, guys. Any ganglion. Number two, my dear friends, remember neural crest cells are also going to form adrenal medulla. Important to remember for your exams there. I hope you all know about the suprarenal gland, adrenal gland. Adrenal gland will be having like two parts. The outer part will be cortex and inner part will be the medulla, guys. Adrenal medulla will be derived from neural crest cells. Number three, remember parafollicular cells. I'm like, totally parafollicular cells. I'm totally like, fed up with this one. Every day, like they are like, so many messages on my WhatsApp and Telegram group and everywhere. Okay, my dear friends, oh my God. Okay, parafollicular cells are derived from the fourth pouch. Parafollicular cells are derived from the, ultimobranchial body. Arey yaar. Remember the the end of this controversy here right now. Parafollicular cells are derived from the neural crest cells present in the thyroid gland. I'm telling you, please guys, that's the final answer. No more questions right now. Yes, no more questions here right now, sir. Neural crest cells are going to form your parafollicular cells. Remember about melanocytes. And number five, my dear friends, remember in the CVS embryology there will be a spiral septum that is formed in the truncus arteriosus. Another one will be the bulbar septum, and that will be formed in the interventricular septum, guys. And these two together, they are said to be the conotruncal septum here right now, guys. Is it okay? So spiral septum and the bulbar septum together, it is known as the conotruncal septum, and this comes under your CVS embryology, sir. Cardiovascular system embryology, development of the heart. Understanding? At least for your MCA exam, another like 2-3 days. At least for your MCA exam, you have to remember these derivatives of the neural crest cells, guys. And out of these one also, please keep an eye on adrenal medulla and the parafollicular cells, guys. Adrenal medulla and the parafollicular cells. I'm expecting this question in the next 31st August exam, guys. Okay, so that is about the neural crest cells derivatives here right now, guys. Understanding here right now? So we are here done with we are actually, see, it is not at all the answer like that, Surendra. It is not like neural crest cells is better than ultimobranchial body. ऐसा नहीं है. Ultimobranchial body is a remnant of the fifth arch. It will be present there. Neural crest cells will migrate and come there, and after migration they are coming there and they are sitting on the ultimobranchial body and forming the parafollicular cells. So please take that very clear, crystal clear. Yes, parafollicular cells are derived from neural crest cells. Okay. ठीक है जी. So that is about that is about the the discussion regarding the neuroanatomy along with the embryology part of the neuroanatomy, guys. Okay, so that is what I wanted to discuss here right now. Manjrekar is asking what is rachis. See, Manjrekar, rachis is both the conditions together, like anencephaly along with the spina bifida. The anencephaly part along with the spina bifida together is nothing but your, yes, rachis, guys. So if any doubts, you can ask me here right now. Otherwise, we'll end the session here for today. So that's all for today, guys. Today it was completely about the neuroanatomy. What are the important topics to be remembered for your exam? And all these are like, high yield topics. Definitely in the exam from our today's 1 hour of discussion, at least we'll be getting like, 2 to 3 questions. 3 questions for sure, whatever we have discussed like today, guys. Okay. Geeta, no. Fasciculus, gracilis and cuneatus, they have both of them have the same functions only. Fine touch, vibration, stereognosis and proprioception. Geeta, they have the same functions. Is it okay? Fine here right now? Yes. And my dear friend, that's all for today. And we are going to stop here our discussion right now today, guys. And I'll meet you tomorrow tomorrow I'll meet you guys. Okay na? Uzma is asking, sir, భోజనం చేశారా? చేయలేదు ఇంకా. Okay na? Class అయిపోయిన తర్వాత చేస్తా. Fine here right now, guys. Okay. So I'll continue with the remaining topics, guys. Remaining topics I'm going to do like tomorrow, like next session. So please follow me on the Unacademy platform also, guys. On the Unacademy app also, you can just follow me for all these kind of free sessions right now. And just keep on following me on the Telegram group of the Unacademy over there. Wherever you can get the update, I'll be updating you with the next one. I'll send you the link of the next class, and in the next class we are going to discuss the remaining topics, guys. Hope this is useful to all of you. Thank you all. Take care, guys. God bless you all, and even keep me also in your prayers, guys. Thank you. All the best. All the best for your remaining preparation, guys.